Hello, I'm Dr. Leon Kelly, Deputy Medical Officer of El Paso County Public Health. Let's talk about the difference between the flu and coronavirus. At first, they sound a lot alike. Both are viruses spread person to person that cause fever, cough, and general crumminess, what we doctors like to call malaise, mostly just to show off. After that, though, there are some very important differences. Public health officials have been effectively fighting the flu for over 100 years, so we know a lot about it. We have medicine for when you get sick, and more importantly, a vaccine that about 40% of Americans get each year to prepare them for flu season. Most of our doctors, nurses, and first responders get the vaccine, so they can still treat those that are sick while protecting themselves and not spreading the disease. The coronavirus causing the current COVID-19 pandemic has never been seen before, meaning no one has any immunity to it. We don't have a vaccine or medicine that has yet proved effective, so the folks we depend on the most to help us when we are sick are just as susceptible as the rest of us. This new virus is also very contagious. Because we have no immunity from a vaccine or prior exposure, it's spreading much more quickly across the globe than a seasonal flu, meaning lots of people are getting sick at the same time. This has caused overloads of hospitals and emergency services in multiple countries around the world. You've probably heard the phrase, flatten the curve, which describes what we at Public Health are trying to do. Slow the spread from person to person so that we all don't get sick at once, doctors, nurses, and paramedics included, so that less people get sick, and those that do are spread out over time, instead of showing up at the hospital all at once, making it hard to not only treat our COVID-19 patients, but everyone else who needs help. The good news, though, is that around 80% of us who do get infected will have fairly minor symptoms that you can easily manage at home. The other 20%, mostly older folks or those with heart disease or lung disease or diabetes, may require time in the hospital. And while we don't know exactly how many people die compared to the flu, we do know that the folks who get sick with COVID-19 stay twice as long in the hospital, and it appears are 10 times more likely to die. So here's the bottom line. While this is serious, we do have a plan. We know it works, but we need your help. Stay home, stay healthy, enjoy your Netflix, and help us fight COVID-19.